Mayong aga sa inyo lahat, buong Pilipinas. Ito po ang inyong host. This is your host, Jing, welcoming you to our program, Koffee Klatch, here on our channel, Sovereign PH TV 911. We are serving our great community and our sovereign nation. Koffee Klatch is a program that discusses issues, and the issues are always brought to you hot and steaming. Today, I am with my co-host, Saldua. Z, please greet our viewers, especially our very dashing Secretary of Health.
Hello, good morning to everybody. Thank you so much, Sir Jing. This is Saldua bringing the brew of your favorite and latest issues to help improve the lives of Filipinos, but bringing them the latest and delivering to you nothing but the truth. Please join us every Saturday for a coffee talk and exchange and sharing views with us. And of course, if you have any comments and reactions, please make sure to do so in our social media platforms below.
Yes, we are here every Saturday, and please watch our program because we bring to you the hottest issues that our audience need to know. Z, please.
Yes, this is exactly right. Aren't we privileged today with our guest who, with his very hectic schedule, obliged to have coffee with us in our humble show. And he is the man of the hour, the person in authority. Our guest has gone through a lot, definitely a lot. And of course, there are many great moves credited to him in this pandemic.
Yes, of course, our guest will give us real information about the state of our country in fighting the pandemic. By the way, don't you know that the daddy or the father of our guest today has also been a former Secretary of Health during the Macapagal administration, and
I actually didn't know that.
he was been doing great in health research and environmental health sanitation and the importance of health community.
Yes, and of course, just like his father, our guest became health secretary first during the administration of President Gloria Macapagal Arroyo in 2005, and then President Duterte appointed him in 2017. But before this, our guest had a long experience in government service from PhilHealth to civil service to GSIS, and he had a stint in the academic community as well. And it may take all day to enumerate his credentials, so let's just get to it. A warm greeting to you on this searing hot morning, Secretary Francisco Duque III.
Good morning,
yes,
Zed.
good morning to you. Good morning, Z, and my friend, Congressman Jing Paras, the guy who's bridging Congress to the executive branch of government. And I thank you for the very gracious invitation in behalf of the Department of Health.
Yes, sir. Our program is live and carried by all the platforms, social media platform. This is viewed by million viewers, and we are very proud to have you today, sir. And a lot of our listeners, our viewers, would really want to know exactly where we are right now. So, without much ado, may I ask you, sir, if you can tell us exactly the state of our government in fighting the pandemic.
Well, right now,
background right now.
Yeah, okay. Thank you. Well, right now, the data show that our total cases number to 1,209,154. But the recoveries are quite high. It's about 93, 94%, no? Reaching 1,134,818. And our active cases are at 53,770. And we see a continuing downtrend of cases, especially in Metro Manila, which was the epicenter of our spike, and also regions 3 and 4A. 4A in particular, you have Batangas, you have Rizal, Cavite, Laguna, and then for Region 3, you have Pampanga and Bulacan. So we continue to monitor these regions, and they account for the biggest share of the national caseload of COVID-19 cases. No? So the downtrend in Metro Manila is a welcome development. It's down now to about 1,500 to 1,600 per day, what used to be 5,000, 6,000, and contributing to 50% of the total
Wow.
caseload. Now it's down to 18%. In fact, yes, the other day it was 16%. Medyo tumaas ng konti to 18%. But this is really a significant reduction from what it was several weeks ago when Manila was accounting for more than half of the total cases. No? So now, while we see a downtrend because of the effective management of our local government executives, and I salute the mayors of the said regions in trying to contain and prevent the continuing transmission of the virus by implementing and intensifying the prevention, the early detection, aggressive case finding, contact tracing, and aggressive isolation and treatment of severe to COVID and critical cases. No? So all these efforts are really showing very positive results, but we hope that there will be greater consistency because although we see a downtrend, this is not irreversible, which means this can result if we loosen up too soon, if we remove the restrictions too soon, then it is very possible that you can have a resurgence of cases, and that's what we don't like to happen. Because if that happens,
Yeah, of
then
course.
you resort to ECQ and ECQ, and the damage to the economy is just too deep, and really it is quite severe. And because of that, I we have been talking to the Metro Manila mayors and other local government executives to really intensify the gatekeeping interventions of yung prevention, compliance with the minimum public health standards, simple, practicable interventions such as wearing of masks, wearing of face shield, maintaining adequate social distancing, and avoiding crowded places or closed, poorly ventilated places. Because this is where the super spreader events happen. No? So I continue to remind our local chief executives that they should be aggressive in identifying their index cases and then carrying out very aggressive contact tracing and
Yeah.
isolation. Because you see, the thing is, the 40-day isolation period or quarantine period is extremely important. Because if you don't do that, the chain of transmission continues. And there will be more heightened community transmission. And if that happens, you're going to get back to your usual spikes and surges, and then you'll close down again. So we're in this cycle of opening and closing, and it's really damaging the economy quite severely, harshly, and this economic downturn, repeated economic downturn, will resort to joblessness, to
Yeah. Yes.
unemployment, hunger, and then also more sickness because people will not have the enough social amelioration support, and then they have to fend for themselves. And then, poverty and disease constitute a vicious cycle. So the more impoverished you are, the more your illness, and the more ill you are, the more impoverished you become. So it break the cycle of the vicious cycle. And so that's what we're doing now is quick, aggressive case finding, active case finding, and then isolate the patient right away, and then do contact tracing, identify all the close contacts, and then isolate all of the close contacts. So within 24 hours, kasi if you don't follow within 24 hours, naging 48 hours, naging 72 hours, ibig sabihin nakaalpas na, ibig sabihin nakawala na yung virus. Mahirap mo
Opo.
nang habulin.
Yes.
So, sabi ko, ngayon habang mababa, this is the time to do it, to do a cleanup operation, a mapping up operation. So, I hope they're listening to my reminders, and this will certainly help mitigate the COVID-19 spikes that we see. No? So, okay naman tayo. The vaccines are arriving. Hopefully the volumes will arrive in about 1 or 2 months, and then we will aggressively increase our vaccination rate so that we will be able to reach the herd immunity as soon as practical.
So, Sec, congratulations for addressing the IITF. You as chairman, congratulations so far. We have really curtailed the number of cases that arise, no, in the past months, and now we are below 5,000, even going below 3,000. So that's a very very worthy action on your part. Now, sir,
Yeah, yeah.
Sec,
Yeah, but Kong Jing, no, yesterday was a big letdown for us because the cases
oh,
yesterday shot up again to 8,700. So you
wow,
see, this is really a slippery slope,
up
no?
and
And
down. Oh.
yeah, so ang hirap dito. So that's why, although bumababa tayo sa NCR, bumababa tayo sa regions 4, A, and 3, we see a surge now in Region 6, for example, Iloilo City, no? And
Iloilo.
then, yes, Iloilo City and Negros Oriental, no?
Yes.
In region,
My home province.
yeah. So sumisipa din diyan. And then sa Palawan, Puerto Princesa is spiking. And then we have continuous high attack rate or cases in region 2, especially Cagayan. And then in Car, we have Apayao, Benguet, ano? So we still have continuing community transmissions. That is my
Sec,
worry.
whom or where do we attribute this spikes? Is it management of the areas, the province, government, provincial government, the local government units, cities? Are they being lax this time? How do we attribute this, sir, so that
Well,
this can be addressed properly by IATF?
yes, we've been trying to address this, and there is a number of factors. For example, the presence of the variant is also contributing to the spikes. The UK B117 variant is one. Number two, you have the South African variant, which was predominant in Pasay in sometime in March and April. No? And then we have the usual B1163. And then now we're really closely monitoring and doing
The
active
Indian.
surveillance for the Indian variant, no? Which is the B1617.2. So all of these are cofactors in the spikes that we see. on top of a diminishing or a poor compliance with the minimum public health standards. People are not wearing their mask properly. You see the mask worn below the nose and below the chin, and that's useless. That's what you call a token compliance. It has no effect at all. That will propagate the virus. And that's
I
such
see.
carelessness, no? And lack of disciplined compliance will contribute to the increasing number of cases. And then the face mask, they use it as a headband, and then the lack of mindfulness over social distancing. People are now again engaged in non-essential activities. They crowd, they gather in places. Kaya tayo nagkaroon ng surge dito sa Metro Manila dahil yung non-essential activities eh.
Good na
Nagbukas
lang
na.
po, good na lang the President has ordered intensifying the arrest of these violators, no? The Philippine National
Yes.
Police
Very
has been
good.
ordered.
Yes, you're right.
I think
You're
that's a very good deterrent upon the instruction of the President.
Yeah, you're exactly right. No? And we hope that they will take heed. They will heed the order of the president to really intensify compliance. Discipline compliance, nothing beats that. Eh. We're not helpless. We have proven armamentaria of protection against COVID. And these are practical, very practicable things to do. Ano ba naman yung face mask? Hindi naman mahal, ano? Ano ba naman yung face shield? Face mask niya, libre pa. The president has ordered distribution of about 20 to about 40 million face masks. The disadvantaged sector of the society, no? The poor barangays and communities, no? Tulong po ni Pangulo ito. Kasi nga talagang nasa puso niya yung kapakanan at kaligtasan ng ating mga bayan. So, kung pwede lang po ay sumunod po tayo dito. Ito po ang tanging panlaban natin at may taglay na proteksyon laban sa COVID-19 at napatunayan na ng mahabang panahon. 15 months na tayo sa COVID. We were able to arrest the spike in July, August. Then we saw the cases going down, di ba? July, August, September, October,
Yes,
November.
yes. You're right po.
December na. December, wala. Baba ng kaso natin. January,
Yeah.
February. You know what? January, February, Metro Manila was only registering 400 cases a day. All 17 cities, ha? Ang laki-laki ng NCR. 400 lang. So kaya, di ba? That's a proof na kaya natin. The whole country, bumaba tayo, less than 2,000. No? So napatunayan natin. Pero pagka nagluwag tayo at naging pabayaan na naman, balik-balik tayo sa ECQ, MECQ, sa pool. Punta naman ang ekonomiya.
So siguro Sec Duque, I think massive information drive talaga sa ating mga kababayan kasi mayroon pa ring maraming pasaway po There's still a lot of those who are very complacent about these things that now Sec, considering that the NCR plus bubble had been reduced considerably in the past days, and we're reaching May 30 or May 31, and that is the end of the the GCQ period. What is the IATF or you personally or or for that matter the government is looking into? Is it going to continue impose a GCQ, or there's a new regime again? I don't know if preempting you, Zek, because that's a prerogative of the president. But ikaw, kung personally, anong tingin mo if we're improving? Kasi you mentioned about the balance between health protocols and the economy. If you can share with us, sir.
I think it's prudent to just wait until Monday because the IATF will convene on Monday to finalize the recommendation to
Okay.
PRRD, no? Oo.
Oo.
So, I think it's in fairness to the president, I would not want to preempt him. I'm
Okay, yes
only
po.
his, I'm only uh, and, I have to respect the protocol and let OP just make the announcement. I will actually present it to the president during his Talk to the People program, which he does with cadence every Monday, sometimes every Wednesday. So we will wait also for IATF to make the solid recommendation whether we're going to extend the GCQ regime or with heightened restrictions, because that's where we are right now. GCQ
Yes
with
po.
heightened restrictions. Now, whether the cases will hopefully continue to go down in Metro Manila or in the NCR plus bubble, no, the regions I mentioned earlier, will depend on the three things. Number one, is the attack rate in these places, okay, now below high risk level. High risk level kasi if your attack rate is more than 7 per 100,000 cases, either in the uh, highly urbanized cities or independent component cities or provinces. So that's the metric we're looking at. Kasi ngayon, ang NCR, sa totoo lang, 15 of the cities are still registering high risk
High
attack
risk.
rate.
Oh,
Oo,
wow.
high risk attack rate pa rin. So unless mapababa yun, mahirapan tayo mag-MGCQ. Siguro GCQ is still going to be the tendency, the inclination. I'm not saying that it is what it should be. What I'm saying is there's an inclination towards that, and perhaps although in fairness, even if the cases are still classified as high risk, they still continue to go down, but not enough to put them in a moderate risk classification. So
Okay.
bumababa siya pero bumabagal yung pagbaba ng kaso. So having said that, we cannot be over eager to relax the heightened restrictions. Maybe we will just choose which of the economic activities may be loosened up a bit. You know, we will do an incremental adjustment, say, from natin. For example, the dine out. We have right now allowed 50%. No? We might be able to increase it to 60% or 65%. O yung dine-in, di ba? It was 20% sa dine-in. Baka pwede increments of another 10%.
Another
So
10%.
30%. Yeah. We have to calibrate. We cannot
Oo.
be
We
imprudent
cannot be
and reckless.
sporadic.
Yes, Cole. You got exactly. You're right.
Z, you want to ask the secretary? Z might want to ask some few questions also, sir.
Actually, there are a lot of things that are part of the factors of why there's an increase. But I think really that the Filipinos really cannot be complacent, because ang nangyayari is once we give them a little bit of freedom, a little bit of leniency in terms of opening up the economy, dun talaga tayo na, okay, that means safe na tayo ulit, which is not the case. It means that we still need to be more diligent if we want to go out. We still need to be more safe. That's why there's a continuing increase every once in a while. But for the secretary, I would like to ask though, what other things, because the DOH has been doing really, really well in terms of providing
Thank
a
you.
vibrant community, providing more social media presence for the DOH. From the past few years, it has really increased awareness for all of the people to see. It's all there available. The information is available. Are there more programs or even more commercials that are going to be produced to increase the urgency of wearing masks and to be socially distanced?
Yeah, we continue with our task group strategic communications rollout of information, education, and communication materials using all quad media. You know, so it's social media, the traditional print, radio, TV. And all we are present. Our presence is is strongly felt across all media platforms, no? And we continue to intensify our IEC campaign, and especially more this time towards demand generation for vaccines to counter the vaccine hesitancy, which could be an obstacle to reaching the herd immunity in as short time as possible, supplies allowing, of course. Because now the problem is we don't have enough
Yes, of
supplies.
course. Yes.
We only
Oo.
have 8 million doses so far received, and out of that, we have just jobbed about 4.8 million, and we have jobbed about 2 million plus for the first dose, and for the second dose, we have jobbed about 1,200,000. So our total jabbed individuals will be about 4.7, 4.8 million. And the rest of the 8.2 million will be used for the second dose. So, there is a time interval between the first and the second dose.
Yeah.
Depends on the vaccines. AstraZeneca, 12 weeks. Sinovac, 4 weeks. Alam ni Kong Jing yan, he just received his, and he knows that he has to go back for the second dose.
Yes, of
Kung
course.
magkagagaya sa iba, ha? Yung iba, after first dose, ayaw na magpa-jab ulit. Naku, that is not right.
In fact, Sec, we want to ask you. Ang dami pong nagtatanong sa program namin. Tungkol po sa yung significance nung first, tapos how long does it take effect, and before the second dose is can you share that to our people, sir, kung
Yes,
yung
certainly.
significance po. Yes. Any vaccine for that matter, Sputnik, AstraZeneca, and the rest po. Except yata one vaccine, which is Johnson and Johnson, na isa lang yata daw yung isang job lang. But I guess all the rest are always having a second dose. Can you give us an insight on this, why there's a first dose and there's another second dose po? Ano pong significance po niyan?
Tama po kayo, ginoong Congressman. Yung atin mga bakuna, except for Janssen of Johnson and Johnson, one dose lang yon, which is good, but it's not enough. We still have very little supply of that. But by and large, for example, Sinovac, you need 2 doses 28 days apart. Okay? First dose will give you partial protection, probably about 40-50%. The reason you need the second dose is to achieve full protection. And when you speak of full protection, you speak of efficacy rate. Okay, the efficacy rate for after the second dose and 2 weeks from the second jab, you will have a protective level of antibodies. Yung antibodies yung sultado sa katawan niya. No?
So
Then
second week pa, if I had that yesterday, I'll wait for 2 weeks to have a full effect on the vaccine that was inoculated on me, Sec.
No. After the second dose. Kasi ikaw first dose ka pa lang.
Yung first dose, anong effect nun?
Hanggang 50% ata.
What extent of protection do I have on the first dose? Wala pa.
Wala pa, 30 to 40%. Mababa.
Okay.
30 to 40%. Okay? That's why you need the second dose. So you want to bring it up so that the efficacy of the vaccine against will be full. And so, the vaccines have 3 fundamental values or 3 fundamental effects. Number 1, it cuts it prevents almost 100% severe to critical COVID infection. Number 2 effect, it prevents hospitalization. And the most important of all is it will prevent death. Ayan. Okay.
Wow.
However,
guarantee na buhay ka.
Yes.
Oo.
Buhay ka. Hindi ka mamamatay. And that is the objective.
Considering I have friends, Sec, would you believe, they spend no less than $500,000 to another. If you, a friend of mine, former Congressman Patrick Antonio, I think from the north, yan. He spent no less than 3 to 4 million in medical medical application or in terms of curing his COVID infection. So it's really so by just one shot you'll be able to forgo with all this trouble.
Yes, especially 2 shots because you need two
Two shots,
doses.
yes. I mean, yeah, 2 shots. So
Yeah, 2 shots, and so that will really prevent you from getting severe to critical infection, and will protect you from the life-threatening, if not life-ending, complications of COVID-19. So
sir,
this is really very
yes.
libre. No, it is free. Number of all, it is safe. It is efficacious or effective. It is of good quality, and it is free. The government has money budgeted for 140 million doses, good for 70 million Filipinos. That is the target, 70% more or less of the population to
Herd
achieve
immunity.
herd immunity.
Opo. But alam mo po, siguro let's also ask this question. The president has also ordered that hindi muna i-reveal yung brand, no? Because there are others who are biased in favor of a certain brand, and this has caused trouble in terms of the vaccination of the local government kasi they go to the V line of those they favored to be like Pfizer. So by not revealing, you will be made to accept whatever is there available. So ang tanong po, maybe coming from you and as an expert, ano ba pong guarantee na pare-pareho lang 'yan? After all, the government, these are all they have all gone through the process, no? FDA approval. So nothing to worry about any of these vaccines, sir.
Yeah,
They are all gonna prevent you to die, so to speak.
you're exactly right, Kong and Z. No, these vaccines went through the rigorous process of evaluation and selection by our vaccine expert panel. Our vaccine expert panel members are really of high repute, and experts, specialists, in the field of immunology, in the field of infectious diseases, in the field of epidemiology. I mean, they have a broad representation of all the specializations that are needed in assessing the safety, the efficacy, the quality of the vaccines. So talaga pinag-aralan yan. I mean, it took them months to study all of this, and they have not stopped studying because these are new vaccines. So it has to really collect additional data from time to time. As
Opo.
the world, as the people of the world are increasingly vaccinated, more and more real world data are coming in. And this help our vaccine expert panel to say, okay, these vaccines are safe. These vaccines are of uh, acceptable efficacy, high efficacy. So lahat po yan, pare-pareho yan. Tama po si Pangulong Duterte dyan, hindi na kailangan mamili dahil lahat po yan dumaan sa
Tama.
napakamalalim at malawakan pagsusuri ng mga bakunang ito. Uh, Kanya, ang gusto ni Presidente, wag lang i-announce. Pero hindi naman nangangatwiran na hindi ka na pwedeng uh,
Pumili at the end of
pumili
the day.
at the end
Pwede
of the
ka
day because
mag-refuse pagdating mo kung
oh,
ayaw mo talaga. I mean, because we have freedom, no? Of choice.
exactly. And yeah, and you have to sign a consent form, di ba? And if you don't like, why will you sign a consent form?
Tama
And if
po.
you do not know, what consent form will you sign if you do not know? So kailangan meron consciousness of the
Informed
vaccine.
consent.
Yes, informed consent. Tama po kayo. Yan ang magaling na abogado natin, si Jing. Alam na alam niya yan eh. These are fundamentals, no? Of,
Yes.
Hey, Secretary, can we ask, why do you think the Filipinos right now are so reluctant to get the vaccine? Because in 2020, they were asking for it. You know, so many people were already demanding that we have the vaccine right now, as soon as we get it. And now that we have available vaccine, a lot of people are hesitant.
well, the vaccine hesitancy is going down. It's
Yes, of course.
improving. More and more, as more and more people are jabbed, the others are much easier to convince as long as they see their friends, their family members getting jabbed. So it will encourage them, no, to
Mm.
also line up to get protected because the advantages are really clear, crystal clear. No? And if you don't get yourself jabbed, you will have the risk of contracting the infection. And how can you have a peace of mind if the risk uh, is continuing? No? So the way to mitigate that risk, to stop the risk, is to get yourself protected via
Mm-mm.
vaccinations.
And
So
from what I understand now, Secretary, to facilitate the vaccinations, the government also allowed private companies to purchase their own vaccines for their own workers and staff. So what's been happening right now in that sense? Have there been many companies or private companies who have taken that initiative to purchase their own vaccines? And how what's the progress there, basically?
yeah, thank you, Z. The private sector, as well as the local government units, are procuring their vaccines via a tripartite MOA with
Mm-hmm.
the government, with the national government, and the vaccine manufacturing companies. So there is one that with AstraZeneca, the Go Negosyo, uh, how would I say it, a
Duque
group of
Concepcion.
this,
Oh.
yes, yes,
Grupo
a
Negosyo
group,
Group. Oh.
yeah, the groupment of businesses or industries under the Go Negosyo group, no, has ordered from AstraZeneca last November pa. Also, the group of ICPSI, the International Container something, leads the procurement through a tripartite MOA with Moderna. So far, ito pa lang yung dalawa. And I think also for Sinovac, there is also another group that has entered into a tripartite MOA with the government and the agents, if not the manufacturing companies of these vaccines.
Well, incidentally, Sec, mayroon tayong participation from our listeners, no? One of the common questions is about AstraZeneca. Ako rin, when I was admitted in the hospital recently, the nurses that I interviewed, no, if they were given AstraZeneca, mas marami po daw side effects. So, tinatanong po nila, bakit, ano pa po pang mga common side effects ng AstraZeneca and Sinovac or any vaccine for that matter? Can you share the common side effects of this and maybe assure them that these are just part of the effect of a vaccine para po hindi na patatakot yung ating mga kababayan.
Ito pong mga minor tawag AFI, this is the adverse events following immunization. Yung mga minor side effects, chills, fever, pain on the site of the inoculation, fatigue, these are transient, recognized minor side effects. And they're also very small percentage, probably about 2%, will experience this. It is the serious side effects that we are talking about here of some of the vaccines. The serious side effects, so far, the National Adverse Event Following Immunization Committee, the one that establishes the causality between the vaccine and a serious side effect. Okay, for example, thrombosis, ah, yung pag-clot ng mga dugo, di ba? For a while, AstraZeneca was associated with this particular condition. But later on, as more and more data came in, they were able to find out that it's not really because of the AstraZeneca. It's a common across several
Doon sa mga tao na mismo.
Oh, doon na sa mga tao mismo, and the incidence is so low, probably about 0.002%. So the benefit still outweighs the risk.
Opo.
In deciding whether to be vaccinated or not, you have to measure the benefits versus the risk. If the benefits continue to outweigh the risk, then go ahead. Have yourselves vaccinated, because that's the only protection that we all can successfully have against the COVID-19. If you don't get yourself jabbed, so you face the risk, continuing risk of exposure. And there is no benefit to being infected with COVID-19. In fact,
Not only that, you're exposing other people pa.
yes, and if you're elderly, you can die of its serious complications.
Tama po
And
yan.
what people don't know also is just, it's not just COVID-19 vaccine ang may ganitong side effect. All vaccines around the world, no matter what it is, it's polio or pneumonia or whatever, all of them have side effects depending on your health, depending on your current situation. So, but like what the secretary said, it is a very small risk compared to the very big picture.
Yeah, you're exactly right. Kaya talagang the evidence is overwhelming that vaccinations will uh, help us restore normalcy in the lives of people, and to also restore what was once a vibrant economy. No? This will be realized as soon as we're able to vaccinate a substantial uh, percentage of our people.
Sir, yung AstraZeneca was prohibited for a while, no? But now, in Europe or elsewhere, including our country, go na po yung AstraZeneca because it has been approved, and kasi may nagtanong lang na bakit daw napigil, at I don't believe na napigil po, no? It's an ongoing. In fact, a lot of Filipinos have already been vaccinated by the vaccine AstraZeneca.
Yeah, you're right. The AstraZeneca paused for a while. Meron temporary stoppage lang until they could establish that the reported serious side effects were actually not caused by the AstraZeneca vaccine. And when that was all cleared, the experts were able to determine, and here in the Philippines, we have no reported event of thrombosis from AstraZeneca, as studied by our vaccine expert, our NAFIC committee, no? The National Adverse Event Following Immunization Committee. So we have done at the national, regional, and local levels. So binabantayan niya, we have the mechanism. And assuming there's going to be a serious side effect, that mechanism, the system is in place. So if that happens after your vaccination, that's why you're being monitored for 30 minutes, di ba? Kong, when you had your first dose,
Yes,
you
yes.
monitored for 30 minutes.
Then they take
Find out.
first they take blood pressure before, then after a few minutes they take again.
Yes,
So,
they monitor.
Oo. So okay
The
naman po.
process is there.
By
Yes,
the
the
way,
system is
I want to announce Si Secretary Sinovac din po kayo, no?
Yes, of course. Sinovac din tayo,
Well,
katulad mo. Mga maganda na lalaki,
Sinovac din ako.
Sinovac.
I didn't get any side effect.
Oh, good for you.
Nangalay lang siguro mga 5-10 minutes yung yung arm ko, but nothing. So let's go for the vaccination.
Yes, let's go.
The
For
government is spending so much money. Siguro Sek,
Yes.
doon sa mga yung trust natin sa information drive, siguro by testimonial. Paggawa
Yeah,
ko kay lalo na siguro yung mga artista pag alam mo naman Pilipino pag nag-testimonial yung mga sunod-sunuran lahat ng mga tao yan. Well, it's just a suggestion.
starstruck. Mga starstruck. Oo. Si Z, mukhang artista. Baka pwede rin si Z.
Yeah.
Hindi pa po pwede, sir. I'm waiting pa because my family and I actually contracted the COVID nung March. So
Sorry.
inaantay namin nung clearance. Yeah, but thankfully we were able to survive it and recover fully. So we're just waiting for the doctor's clearance for us to get the vaccine.
So, sir, ito lang po, I was not able to ask you. Considering now that the government is able to address and slow down the infections. Although from time to time, like nasa below 3,000 na tayo, tapos biglang nag-8 pero bababa na. But vis-a-vis that, do we have enough facilities now? No, we are no longer for a while. About 2 months back, we were able to cope up now, currently, with the available facilities, ICU, yung mga rooms available po. It would seem that your team has including the DPWH, has been able to set up all these facilities in due time.
You're right. We continue to expand our temporary treatment and monitoring facilities. By and large, we've added a substantial number of beds, no? And more importantly, we have also expanded the ICU bed capacity. You know, of all the hospital systems, it is the ICU that is the most important. Why? Because it is where you save lives, no? So all the other isolation rooms, the quarantine facilities, mas madali yan, no? To manage and also to expand. But it's the ICU that is really crucial because, and right now, our ICU capacity has improved tremendously. Ang laki ng dagdag ng ICU in Quezon City and in Metro Manila. If I'm not mistaken, about 400 ang ICU beds na nadagdag natin. That's why bumagsak din yung ating ICU utilization rate because of two things. Of course, cases going down and also the beds increasing. So utilization has gone down, which is good. It's at the safe level, safe zone. So at that level, the healthcare system's capacity can manage another surge. But let us not have another surge. Because if you have another surge, pagod na yung mga doktor natin eh. Pagod na yung mga nurses natin. Pagod na yung lahat ng mga nag-aambag ng kanilang pangangalaga at pagsalpa ng buhay ng mga COVID cases. Ano yung critical? So, wag na tayong na-ulit sa surge na ito. At harito pa, tanggap na tayo ng sapat na bakuna para hindi na talaga mabalik ang mga spikes. At matagumpayan na natin ang COVID-19 fight.
So lastly, Zach, on the vaccine, it would seem, I think Secretary Galvez has announced the deployment, no? And he mentioned about there should be about 500,000 inoculation daily in order to achieve the 70% herd immunity by November. Do we have a prospect of achieving that, sir? And in what month probably can we really go into that so that we'll be able to achieve herd immunity uh, as what the Israeli government has achieved for their country, Secretary?
You know, Israel is such a small country. It's less than 10 million. The population less than 10.
Opo.
Population less than NCR. No? So
Opo.
we cannot be comparing ourselves to such a tiny country. No? So what is important is, tama si Secretary Galvez, the goal is to achieve herd immunity by end of 2021, and we will inoculate by then 70 million Filipinos. At 500,000 jobs per day, let me just do my math. 70 million divided by 500,000, you will have 140 days to be able to complete the first dose of 70 million Filipinos. Okay? Now, you will have about the same timeline for the second dose. So, all in all, it's probably going to be end of December or until first month of 2020. Thereabouts. No? Thereabouts. But it's achievable, provided the criteria is supplies are enough.
Yeah, and that's the big question, Sec. From your
Yes.
end, do we have the ability, considering that Secretary Galvez is expressing confidence, but do we honestly, just for our countrymen to be able to really absorb all these announcements, do we really have the capability in accordance to what they're saying that I think by the month of July we shall be able to get a 500,000 daily inoculation. Ikaw po, from your point of view.
From my perspective, the volumes will start arriving June next month. No? I think about 7 million or 8 million, and then July probably about 12 million. And so the procured vaccines will start arriving, Kong and Z. No? So
Okay.
once we have, for example, in Metro Manila, the requirement is 3 million a month, of
Okay.
doses to be able to reach the population protection for NCR.
Metro
For
Manila.
NCR, yes,
Mm.
at about 100 to 120,000 jobs per day. Okay, they'll be able to finish it in about say about 120 days, about 4 months, 3 to 4 months. So, yan ang mangyayari. We are confident we will be able to do 500,000 jobs a day nationwide, provided enough vaccines are here. If not, mahirap magsalita because they keep asking me, and I always tell the media, unless I know the exact arrival of the cargo plane, I cannot tell you when it's going to.
Tama.
Diba?
Yeah.
Mahirap para. Oo.
Oo, mahirap nga talaga because everyone is grabbing for the supply.
Totoo
All
yan.
countries
Everybody's
in the world,
demanding.
all countries in the world.
Oo. Yeah, the whole world is really competing for a very limited
Saka
supply.
yung iba may advantage kasi dala-dala na nila sa maleta yung pera eh.
Oh, yan, kaya nila yan eh. Israel, ganun
Kaliwaan,
ginawa.
kaliwaan na
Pare, Israel paid twice for their Pfizer cost. Can you imagine that? You do that here, mabibilanggo ka. Ombudsman ka, Senate investigation, congressional investigation, left and right. So sabi ko
Oo nga
ganun,
eh.
that's crazy. Oo.
Yes, so
We must change our laws. Bumalik ka na sa Congress. Palitan natin yung batas, Kong G.
RA 9184 eh.
Yeah, that's right.
Oh,
Mahirap. Oo. So, ibang governance. Ibang governance dito. And you cannot
opo.
really compare. Yeah,
Oo.
una-una, Israel so small. Di ba? You cannot even begin to compare. Yeah, 107 million as against what? 8.8 million.
Tama po. Oo.
That's just 10%
Well,
of us.
opo. In closing po, let me ask kasi na-miss ko na yung board natin sa PhilHealth eh. May I know po what's going on there, and how is our universal healthcare going along in terms of implementation po?
Well, the universal healthcare implementation has faced some setbacks, no, because of the COVID uh, pandemic. But we are trying to regain our composure to pursue the important provisions of the universal healthcare law. And the expansion of the primary care benefit package is a priority among others. And PhilHealth is targeting, I forget the numbers, but it's in the right direction. It is in alignment with the mandate under the Universal Healthcare Law. So PhilHealth is very conservative, I should say, and careful because you know naman the series of investigations that it had to go through, and many, of course, were allegations that were bereft of evidence and truth. And so now, of course, the response of the field management is really to be more cautious, prudent in the administration of the National Health Insurance funds, so that COA will also, so that it will be in the good graces of COA, that it's following all the proper auditing and accounting rules and regulations.
Sir, one last question because we're about to end. We only have a few minutes. There's a question here on the OFWs. Considering that there are various variants that are already in our country, and a lot of our OFWs are in the Middle East, no? And especially the last one, the Indian variant, malapit lang yung India doon sa Middle East. Are there curtailment or provision of flights imposed upon by the IATF from Middle East to land in the country, yung mga airlines to ferry our OFWs? Kasi according to this question, lately daw in the last few weeks, nag-slow down daw ang arrival ng mga repatriated OFWs. But it seems that the president has warned the local governments and other government to not to curtail or not to stop the repatriation of a lot of our OFWs abroad, especially in the Middle East, who have lost their jobs, and the president wanted them to return to the country. Is there a regulations now or guidelines that flights are not allowed to land, especially those from India and the Middle East po? Mayroon bang ganon?
Yeah, meron tayong select few. We are extending travel ban on countries in India, in Nepal, Bangladesh, Pakistan, Oman, UAE, in the Middle East. But
Saudi Arabia and Kuwait, kasama po
wala
yun?
pa. Hindi pa naman natin isinama. Dahil we are awaiting reports from the International Health Regulation as to the incidence of COVID-19 variants in those countries. So wala pang malinaw na report ang International Health Regulation of the WHO where we get the information. So we close our borders to all these countries as I have enumerated them. But whether we will expand it, I really am not sure because we are awaiting the recommendation of our epidemiology bureau and also our technical advisory group of experts with
Yes.
whom we are in constant communication.
How do we balance this, sir? instruction of the president that the OFWs must be given priority to be able to reach their destination in the towns, cities. However, because of the restrictions of flights of our OFWs in those country, so how do we find the balance that the OFWs should still be repatriated? Pwede ba yung magkaroon ng exemption uh,
Uh,
or exception to yung mga flights na darating pwedeng OFWs lang at automatically they will be quarantined immediately para lang hindi po mahinto po yung pag-repatriate natin ng purely OFWs lang po from abroad.
yeah,
Is
yeah.
there
I
something
think yeah, we have been doing that actually.
okay.
The OFWs, except for the countries na like India, hindi muna tayo tumatanggap ng OFWs from those countries. But from other countries like Saudi Arabia, where there is no travel ban, they have been coming home and provided they comply with the strict quarantine protocols of test on the 7th day from arrival, continue quarantine until the 10th day, then turn over to the local government quarantine facility or in the uh, homes of these OFWs, provided that the homes
They continue the
have
quarantine.
correct, yes, have the correct features as embodied in our guidelines. No? May sariling banyo, sariling kwarto, hindi expose yung mga matatanda. So, may mga ganun precautions. No? But the system is already in place, called Jing. So, at least by doing that, the strict border control, the strict isolation and quarantine protocols complied with will ensure that there will be no transmission of this variant into the communities. And that is our duty to ensure that none of these will be in the communities. So very strict tayo. Quarantine is so strict. Border controls, quarantine, isolation protocols. We cannot relax any of these. It is a
That's what
folly.
that's what
Yes.
it would be naman talaga no?
Right.
So you have another question? Yep.
No, I just wanted to add that more and more countries are also requiring vaccination if you want to travel there and to work there. For example, Saudi has already also imposed that if a Filipino wants to come to Saudi, they have to be vaccinated already before they travel there for work.
That's
So
why I
I
guess
think,
Yeah, that's a policy that
yeah.
yes, sir. Please. Sec, you're saying? Wala si Sec.
yeah, as I was saying, that is the government's policy of
Mhm.
Saudi Arabia. So we have to comply. We have no
Yeah.
choice. That is a
Opo.
statutory, you know, compliance. No?
That's why I
So
guess siguro kaya nga hininto muna yung deployment doon sa Saudi. I think the Department of Labor has tried to evaluate muna kung papatuloy ba tayo. However, marami pong nagiging stranded na may mga job orders na yata, that are bound for Saudi Arabia.
yeah,
Yeah.
the DOLE and POEA are resolving the issue. They have to clear some things, and then I'm sure there will be more clear, definitive solutions.
Okay. Sec, thank you so much. It's really an honor and our privilege to have you today. And with your busy schedule, you spared us a little of that, and we are so thankful. And mabuhay po kayo. More power to you, Secretary Duque. And well, have fun and keep safe.
Thank you very much again in behalf of the DOH. Thank you, Kong Jing and Z, for the very gracious invite and for helping me reach the public with the most current information and advisories that will benefit our people. Thank you, and hope to
Thank
see
you
you
so
again.
much.
Congratulations, because I think this is a very good show. This is at the Facebook. It's for people to really benefit from a such a platform and a source of credible information about. Thank you. Congratulations.
Thank you po.
Thank you
And
so much.
Z, you want to have a parting word?
Yes, to say it was truly a pleasure to have you with us is an understatement, and we appreciate your presence and hope we can have you with us again. Thank you again, Secretary Duque. And we don't have to wait for the coronavirus to dissipate to do all this precautions in spite of the vaccines. We have to encourage Filipinos, our kababayans, to continue to stay safe and follow the protocols. And we hope that you will oblige to have coffee with us again next Saturday. We have a long list of guests, and our next will surely have us all glued to the channel Sovereign PHTV 911. Announcements will be posted on our social media platforms below. Thank you again, Sir Jing, for having me. Until next week, this is Z Saldua.
Well, thank you, Z. And marami pong salamat, mga kababayan. Good morning once more to all of you. Mayong buntag, mayong aga, magandang umaga po sa inyo lahat. Please tune in every Saturday to this channel, Sovereign PH TV 911. Good luck and keep safe always, mga kababayan.